Hi there. What brings you in today? Hi. Um, I've been feeling off. I'm not sure what's going on with me. I'm always tired, irritable, my periods all over the place. Um, do you think it could be a start of a menopause? Sounds more like an anxiety. I'll prescribe a low-dose antidepressant. It often helps with mood and sleep. But I don't feel depressed. I have read that this could be hormonal. Not necessarily, especially at your age, and you are 44, very young. Besides, SSRI can help with hot flashes too, so let's try that first. But I'm not having any hot flashes. Did you know that usually it takes women 5 to 6 doctors' visit before they're diagnosed with perimenopause? Now, if you want to avoid the scenario you just watched or reduce your visits to just one before you're diagnosed with perimenopause, follow these steps. Number 1, find a menopause specialist. If you're in US, you can do that by accessing Menopause Society database of physicians and practitioners who specializes in menopause. Number 2, track your symptoms leading up to your appointment. Try to gather data for at least 4 weeks. For your symptoms, write down the start date of your symptoms, severity of the symptoms, and the frequency of the symptoms. Number 3, read or print 2022 Hormone Therapy Position Statement and GSM, which is Genitourinary Syndrome of Menopause 2025 guidelines. I'm linking both documents below. Now, if you follow these steps, your next appointment will look like this. Hi there, what brings you in today? Hi, I found you through the Menopause Specialist Directory. I am 44 and I'm suspecting that I am in perimenopause, and I've been tracking my symptoms for the last 4 weeks. Wow, that's a great start. So let me look at the symptoms that you've been tracking. So I see that you're having sleep issues, heavy periods, migraines, and low energy. Okay, so let me ask you this. Have your eating or activity habits changed recently? Not really. My routine is pretty much the same. Alright, before we focus on perimenopause, I want to rule out all other causes. So I'll order labs for your thyroid, vitamin D, iron, let's do cortisol, and your comprehensive metabolic panel. This broad workup will help us not to overlook something that might mimic or add to perimenopausal symptoms. Makes sense. I've heard estrogen decline affects metabolism and thyroid too. Yes, estrogen plays a role in many body symptoms. It can definitely affect your metabolism and even how your thyroid functions indirectly. So low estrogen levels could possibly contribute to issues like feeling sluggish or changes in weight, but it's usually just one piece of the puzzle. That's why a full workup helps clarify things. Will we need to wait for the lab results to discuss perimenopause? No need to wait. We can start the conversation now. You have done your homework, and we can talk about perimenopause and possible treatments right now. The lab results will simply give us more information by the next visit. Great! If you don't mind me asking, are you up to date on current treatment guidelines for perimenopause and menopause? Absolutely. I follow NAMS, which is North American Menopause Society, and now it's just a Menopause Society, 2022 guidelines, and stay current with the latest research. I make a point to keep up with the new research and guidelines, especially in menopause care, because this field has evolved a lot in just the past few years. So yes, you're in a good hands, and I'm up to date on the newest recommendations. Good. What do you think about that 2002 Women's Health Initiative study? You know, the one that caused so many women to stop hormone therapy overnight because it scared everyone? Yeah, unfortunately, it caused a lot of confusion, but the good news is the follow-up research showed that the risks from that study were overstated, especially for women under 60 or within 10 years of menopause. It showed that benefit-risk balance for hormone therapy is generally favorable, provided they don't have significant risk factors. So while we always take the risk seriously, we also don't want to throw out the options of hormone therapy when it can greatly improve quality of life. The key is to customize the treatment to patient situation. So if my labs and symptoms align, I'd like to get started on bioidentical hormone replacement therapy. That's reasonable. I use FDA-approved bioidentical hormones, estradiol and micronized progesterone. Now, for perimenopause, labs can help, but diagnosis is mostly clinical. What labs are we running? So we are running a comprehensive metabolic panel, thyroid, vitamin D, CBC. We're going to check your cortisol level, inflammatory markers, and of course your sex hormones like estradiol, progesterone, FSH, LH, and testosterone. So how do you decide if someone's good candidate for HRT? I'll look at symptoms, severity, health history, age, and preferences. You seem like a good candidate pending lab results. So how do we monitor HRT safety and effectiveness? We'll track your symptom relief, watch for any side effects, and continue regular checkups, usually every 6 to 12 months. So what HRT type do you usually prescribe? I often start with a low-dose estradiol patch or gel plus nightly progesterone, but we'll tailor it to what suits you best. Can I get vaginal estrogen too, just in case? Only if you develop symptoms like dryness or urinary issues like recurring UTI. I don't see any need to start it preemptively. Let's get those labs done and reconnect. You are doing all the right things and glad you came prepared because it really helped us use our time effectively and we covered a lot in the last 15 minutes. So we'll continue this conversation once your results are in and we'll get you on the path to feeling better. Take care and I will see you soon. Thank you so much. I agree. These 15 minutes has been well spent and been very helpful. I feel a lot more confident and relieved that we have a plan. I hope this mock consultation gave you an idea of how good interaction between a doctor and patient looks like and gave you confidence to self-advocate for yourself during your next appointment. Now, I would love to hear from you. Now, if you need help to streamline your set of questions, please let me know and I will love to do that. If you found value here, please don't forget to hit the like button, subscribe, and share. Now, if you really want to know why 2002 WHI study was so confusing, click here.